Barbara Mutesi is a living testimony. She is now living her third cancer-free year after she was diagnosed with cervical cancer in 2016. Mutesi was referred to Mulago Hospital after her medical checkup in Jinja that year. At Mulago, she tested positive for cervical cancer and started on medication. She is now undergoing a review after successfully completing her treatment. The renewed vaccination campaign against the HPV is due to the high mortality rates of cervical cancer in Uganda. This type of cancer kills more than 4,000 women every year in Uganda, and the Human Papilloma Virus is one of the known causes of the cancer.
The Human Papilloma Virus, as I said, is a DNA tumor virus that causes epithelial proliferation of the cutaneous and mucosal surfaces.
The virus, when it infects human beings, it can do so many things. It can cause common warts, which we call ensundo, which may appear on the face, which can appear in the hands, which can appear on the soles of the feet. But the good thing is that many people clear this in 3 years without any problems. But in many cases, the fear is that it can lead to cancer.
Certain strains of HPV cause cervical cancer. These strains might also contribute to other cancers.
In women, it can cause cancer of the outside of the vaginal canal, called the valvular cancer. In men, it can cause cancer of the penis. And of course, in both men and women, depending upon the type of sex they have performed, can get throat cancer, mouth cancer, can even get anal cancer.
The virus lives mostly under the skin of the male genitalia, and infection occurs when the virus enters your body, usually through a cut, abrasion, or a small tear in your skin. The virus is transferred primarily by skin-to-skin contact.
It lives there because it is warm, it gets warmth, to get some moisture there, and that virus thrives. And you pass it on to your partner without knowing.
On Wednesday, the Health Ministry revealed that the vaccination campaign will majorly target school-going children.
Because the children are already mobilized and they are under a guidance.
However, the 3-year review report shows that more than half of all the children that took the first jab of vaccination did not return for the second and final dose. This has implications, according to Dr. Vincent Karuhanga.
The first thing is that immunization should be done before sex, before one has started playing sex, because it is very, very common sexually transmitted condition. And because of that, once a person has got the virus, it is useless to vaccinate that person. When it is given early, protection is higher than when it is given much later, so that if it is given after 15 years, then 3 jabs may be required instead of 2. So people who are taking 1 jab are not really protected as much.
Dr. Karuhanga advises on how to handle such cases.
Provided that person has not gone beyond 15 years, that person can get a second jab without having to start all over again. But if it is after 15 years, then that person should get the other 2 to make 3.
He also says vaccination does not completely eliminate the chances of suffering from cervical cancer.
In Uganda here, we immunize only against human papilloma virus 16 and 18, which cause only 70% of the cancers of the cervix. There is a tendency in Uganda for people, once they are immunized, to think that they are not going to suffer from that condition, and therefore don't protect themselves.
The Ministry of Health says they have invested a lot of resources to ensure success of this renewed campaign.
We started by engaging key
all principal stakeholders, Ministry of Health, Ministry of Education and Sports, the EPI partners who are not necessarily within government, within the UN circle, and even some quasi-private sector actors.
We have put in about 2.9 billion shillings, and this money has already been sent to the districts. So we hope that 2019 there will be more girls vaccinated against this killer disease.
Walter Mwesije, NTV.